As a practicing medical doctor with a focus on sexual and reproductive health in my daily practice, I view the practice of medicine in itself as a way of defending human rights and a very important tool to ensure that we recenter those affected by structural inequalities and those experiencing intersectional and multiple forms of discrimination. And this could be based on their age, their disability, gender expression, gender identity, sexual orientation, occupation such as being a sex worker, socioeconomic status, or irregular migration status. Obstacles stand between individuals and their enjoyment of sexual and reproductive health rights globally. And these obstacles are interrelated, they're entrenched, and they compound each other and occur at all levels of health systems. Some of these obstacles have their roots in patriarchy and colonialism, and others relate to structural and systemic inequalities resulting in differential access to the underlying determinants of health, as well as services, goods, and facilities. I assert on how patriarchal oppression and what I often call patriarchal violence is universal. It permeates all societies, and it is at the very origin of the erosion of autonomy and self-determination. It seeks to control girls' and women's bodies, as well as those who are gender non-conforming and the LGBTQA+ community, and control sexuality to the detriment of the enjoyment of the sexual and reproductive health rights. In the report that I prepared and presented to the United Nations General Assembly titled Sexual and Reproductive Health Rights, Challenges and Opportunities During COVID-19, I underscored in that report to member states that there is no doubt that the COVID-19 pandemic has further thwarted the realization of sexual and reproductive health rights. Even when countries had classified sexual and reproductive health services as essential, in line with UN human rights mechanisms and recommendations, pandemic-related responses seriously impacted availability, accessibility, acceptability, and quality of sexual and reproductive health services. For instance, maternal and newborn healthcare services that were guaranteed in a majority of countries became less available and inaccessible or unaffordable for millions of pregnant people globally. Essential commodities and contraceptive supplies were also disrupted, placing the needs of women and girls at heightened risk, and of course putting them at indirect risk of unsupportable pregnancy. Regarding safe abortion as well as emergency contraception, we've seen how some states have unfortunately created even more legal and service-related barriers and policy barriers which have sought to thwart this aspect of access to the right to health. The report also recognizes that positive opportunities arose and that some states and other stakeholders created a more enabling environment for accessing services, including using telemedicine. The report also recognizes positive opportunities that some states and other stakeholders created in an enabling environment for accessing services, especially using telemedicine and telehealth. A challenge that remains is that the gender digital divide in much of the so-called global south and other developing contexts risks excluding many people from digital health innovation. I must also caution that artificial intelligence technologies embedded in digital health are not neutral, and that algorithms and designs may themselves reproduce racism, ableism, transphobia, and sexism, amongst others. Historical and present obstacles to the realization of sexual and reproductive health rights have been compounded by the COVID-19 pandemic and relate to the previously mentioned patriarchal control propelling the current global regression against women's rights, the LGBTQA+ rights, and persons and sexual and reproductive health rights in general. I want to underscore that sexual and reproductive health rights are human rights, and they are rooted in binding human rights treaties, in jurisprudence, in consensus outcome documents, as well as international human rights law. As clarified by the Committee on Economic, Social and Cultural Rights in General Comment number 22, the right to sexual and reproductive health entails important freedoms and entitlements, and they're an integral part of the right to health. Sexual and reproductive health rights are grounded in the right to life, to dignity, to education and information, to equality before the law, and non-discrimination. And these rights also include the right to a pleasurable, satisfying, and safe sex life, freedom from discrimination, coercion, and violence, and freedom to decide if or whether to have children, whether to get pregnant, and to decide on those pregnancy outcomes, as well as a right to have the information to make informed decision. And the right to privacy is very important to the right to health, and all these various rights are key from a perspective of the mandate that I hold. I also recommend that states strive to be less dependent on donor aid in order to meet their obligation under the right to health. While domestic health spending in low and middle income countries may be rising, it is still the truth that some are depending and will continue to rely heavily on donor funding. The impact of the COVID-19 pandemic has been determined by public health policy as well as leadership. And I underscore that civil society plays a key role as an agent of change. The analysis of the COVID-19 pandemic should be based on the extent to which the right to health principles were applied and continue to be applied in the response, in the future pandemic planning and responses, and to the extent to which sexual and reproductive health rights were protected. Accountability is essential in the right to health, and if it's going to be more than just an aspiration. I remind states of their obligation to respect and protect key principles of autonomy, bodily integrity, dignity, well-being, transparency, and accountability, especially in relation to sexual and reproductive health rights. I assure you of my commitment and endeavor to engage with all stakeholders during my continuing tenure as a special rapporteur to pursue this aim of ensuring that we uphold the right of everyone to the enjoyment of the highest attainable standard of physical and mental health, and to ensuring that we create and co-create communities and societies that are conducive to a life of dignity for all.